and Lifts, your stairlift expert.
You know, amid the difficulties of this COVID year, there have been some bright spots. I think one of them might be the way we've found a way to connect with our doctors more easily via telehealth. Likely, that is not going to be going away. So it's a great time for us to have a conversation with Dr. Chelsea Ryan. She is with CHI Memorial's Integrative Medicine Associates, and she says, as far as she's concerned, those telehealth meetings are still here to stay. Great to see you.
Good morning, how are you?
I am fine, thank you. I mean, I know that nothing can ever quite replace in-person, face-to-face, but sometimes doing something virtually is best for everybody.
Yeah, that's correct. So when I started here at Memorial, it was April 1st, and it was basically when we first started using telehealth and video visits. I had never done virtual care before, but I've really found the convenience and the importance of utilizing this platform in our healthcare system.
I would think that for many people, I'm thinking back to my days when my kids were little and I was, being pulled 4 different places at any one time. I couldn't always get to the doctor for myself, or if one of your kids is sick and the other one's not, you hate to make everybody jump in the car and go. This way you have an easier access.
Yes, exactly. So I've actually done a couple of visits with some parents hiding in the closets with banging kids on the door. So this has been a really good way to, catch up with patients who can't come in, whether they are at work. And I mean, who really wants to take off a full day to go to the doctor when you could have that quick kind of follow-up, touch base with your physician, alter some medications, or just kind of talk it out with them. This is a really easy, quick way to keep in touch with your doctor. And I feel like sometimes we can really provide more thorough and better follow-ups when we can have this. So it has been a very convenient and pretty much I can do a lot of the same visits in person and on telehealth and video visits. So a lot of good visits for video visits would be anxiety and depression. If you have a good trustworthy blood pressure cuff, hypertension, glucometer at home, we can do some diabetes follow-up, and some acute care issues like sinusitis or UTI. So it has been really helpful for even those patients who are down at the beach on vacation and they think they might have a UTI. They don't have to go to an urgent care or something like that. They can just kind of give me a call. Other patients that have been utilizing telehealth have been those college students who go away but still have their home base here in Chattanooga. That has been really helpful. And lastly, patients who are maybe not as mobile, or it's not easy to get them into the clinic. Family members have difficulty getting them into the car. As long as the visit is appropriate, we've been able to do a lot of care over virtual visits.
So are there any things, those are all very good points, but are there any things that people need to do preparation-wise that might be a little bit different than when they're coming to you in the office?
Yeah, I think that first going through, our office personally sends out a tip sheet to kind of try the Zoom out. We use the platform Zoom, and a good way is to just kind of get familiar with it. Good lighting, having a good, internet connection is great. And then also being able to get some objective data. I think having a trustworthy blood pressure cuff, heart rate monitor, oxygen. Now, a lot of people have pulse ox now with COVID, so that's really nice. Being able to get a temperature. If you have diabetes, being able to go through your glucose meter or have a list of your sugars is great. So just kind of having some objective data that we would have here in the clinic is really nice, because sometimes we have to make some decisions based on that data.
And do you ever do it where you have maybe beginning with a virtual visit, if you will, and then based on the conversation and what you're observing, you say, you know what, I think I'm going to need you to come in. Let's get you scheduled.
Yes, and I have found that patients are actually very grateful for that. In the beginning, I thought, oh gosh, I've committed to this virtual visit and I don't want to have to bring them in. But honestly, after talking to them, getting a story and be like, wow, I need to press on your belly. I need to listen to your lungs. I'll either bring them in that day or the next day. Some interesting stories back when the pandemic first started and nobody wanted to leave their house or go to the ER. I mean, there were several people I ended up sending to the ER and being hospitalized for significant problems. I'm talking bacterial infections in the blood, obstructions of their bowel. And so when I think back on those days, what could have happened to those patients had we not just talked it out on virtual care, what might have happened to them. And so I'm very thankful for this platform, even though sometimes it is not appropriate for what visit. I think it is a good starting point if a patient at least wants to talk it out and figure out what the next step might be.
Well, and before I let you run, you are a doctor of osteopathy, so that means that you can prescribe medicines, but you're looking at the whole person. You have some additional training. So by peering, not that you're going to be voyeuristic, but by peering into their home environment and fostering that conversation of what's happening in their day-to-day life, does the virtual help you a little bit that way too?
It does, because I think when you see somebody in the office, it is the same background with a different patient. So you see that patient in the exact same room, and you're not seeing, you know, sometimes I see their kitchen, or I see maybe they're kind of not able to get up and get around. They have a lot of stairs, and they're also more comfortable about sharing sometimes in their home. And I have found that patients have been able to better open up. I meet a lot of pets on Zoom, which is always very interesting, and that's one of my favorite parts. But yes, I am able to basically learn a little bit more about their lives just by observing them in their state and their home.
Well, I always enjoy talking to you. We've only known each other virtually. One day you and I too will meet face to face. But thank you so much for your time this morning.
Oh, it was great to see you again. Have a wonderful day.
You too. And here's how you can get in touch with her, Dr. Chelsea Ryan. Again, she's up on Signal Mountain at Integrative Medicine Associates. Her phone number and website there on your screen, 886-2004. We're back after this.
Ashley Home Store Spring Semi-Annual